Hi guys, welcome to another episode with the Dreamers. And today we have a special guest. She's a COVID-19 survivor. Help me welcome Aprajita Bhattacharya, aka Appy. Hi Appy,
Hi,
welcome to
Appy.
our
Hi,
podcast.
Appy.
Hey guys.
So Appy and I are friends since our university days in the UK. She's from India and right now she's pursuing her PhD in molecular biology in New York. You are our first guest over here in this podcast. You were also the first subject that I used when I bought a new lens in the UK and also when I bought the new flash in the UK.
That's true.
So at least 2-3 project mein you are my guinea pig.
I'm your guinea pig, yeah, exactly. But I think usually you offered free food.
हाँ.
That's the only reason I visited. It's like, ठीक है, खाना मिलेगा तो I'll be there. I don't care.
So, Appy, I'm very curious to know about when you figured out that you have COVID-19. What was your first feeling? What was your first reaction to it?
To be completely honest, like I didn't know कि I had COVID-19. I just got sick. I had a fever for a whole day. उससे पहले भी मुझे symptoms थोड़ी आ रही थी, cough आ रहा था. But जब fever के बाद, I lost the sense of taste and smell. So everything tasted like cardboard. I couldn't smell anything at all. उसके बाद, looking back, I thought this is COVID-19. But the thing is, I was very fortunate कि बहुत ही mild था मेरा case. Thankfully, I think my immunity handled it. So I only had like 1 day of true pain. I think it made me nervous that I would never get my sense of smell and taste back. But other than that, I don't think I ever thought I would go like to the hospital.
So did you try to like smell a lot of things to just figure out कि क्या smell हो रहा है क्या नहीं हो रहा है? Was there
Coffee?
anything that you were able to smell and were not able to smell, or it was completely
So-
gone?
No, it was completely gone. I couldn't taste any food that I was cooking. Then I ordered pizza one of those days because it's really depressing when you're sick and you cannot, like, you go to food for comfort sometimes and you cannot even, because half of the taste is also your smell, right? And you cannot even smell anything. So I was like, okay, maybe I'll order pizza. Maybe I'll be able to smell. Because I didn't even know, it was so early that the research was not even completely out there. So I didn't even know that this is a thing for coronavirus. But I tried tasting the pizza and it tasted literally like cardboard. You know, it didn't have any flavor at all. In the moment, I was just like depressed. I'm like, this freaking food doesn't even bring me any joy. And I'm stuck indoors.
At what point did you think कि probably I should go and get myself checked?
So the truth of the matter is that my roommate had flu-like symptoms. And because of that, I figured if I'm living in the same apartment with her, we should both quarantine. And I didn't even have any symptoms yet, but because we were sharing space, kitchen, bathroom, I was like, okay, we're both going to quarantine for 14 days. And on day 1, we both called a health center. Can we get tested? And their recommendation was testing is limited. This is mid-March. Shutdown started right after that.
And
So-
this is in New York, right? This
This
is
is in New York City. So their whole thing was, if you want to get tested, it's gonna A, take a lot of work and time, and B, like if you don't have painful symptoms yet, like if you're having trouble breathing and stuff, then yes, you should come. If it's mild symptoms, stay at home, just quarantine yourself.
How did you know you were COVID positive? Eventually you got tested, right?
Good question. So I, at that moment, never got tested. After 3 months, before we went back to work, we were asked to get tested for COVID-19 and the antibody. And now we have enough tests that New York is providing it to New Yorkers for free. And you can get tested like once a month even. And so I got both tests. COVID-19 was negative, which makes sense. But COVID-19 antibodies was positive, which makes sense in light of the infection I had back in March.
Do you feel
Yeah.
empowered now? You have the antibodies,
Have the
superpower.
antibody. No. I still wear my N95 mask when I go to the subway. Like,
Those antibodies do not last very long, I suppose. Again,
don't know.
vulnerable to the
We don't know
virus.
about it
we don't
yet.
know. It hasn't been very long yet. I know 3 months it lasts for me. I read at many places if you're asymptomatic or if you have a mild, very mild response, your antibodies go away within a week or two. मेरा थोड़ा ज़्यादा शायद था. So 3 महीने बाद भी I have antibodies. But I don't know, maybe 6 months I'll be also like negative for antibodies. I don't know yet.
So, Appy, do you have any idea from where you have caught this virus?
Again, good question, but it's impossible to say because like the infection start होने के just बाद shutdown happened, and उसके just पहले we were going about our lives normally. So I was in the subway with so many people. I was in the station. I was in lab. I was in the Like I went to the grocery store, so who knows? Like it could be. It's likely that it was from maybe the subway or something, but I have no idea. It's
So
impossible.
before
to say.
lockdown, New York में sanitizers, masks, people were using all those things, or it just started after lockdown?
Some people were. Beginning में, there was also a scarcity of masks.
Scarcity of masks
Huh.
and
So
toilet
people-
papers.
So yeah, so government told us not to wear a mask because then you're stealing it from the healthcare workers who really need it. And so people who were wearing it, they were kind of wearing it guiltily. Like a month later, it was like, no, if you're not wearing a mask, you cannot go out in public.
So did you share this information with your family and friends in India?
Yeah, I told my mom and my close relatives that I was having these symptoms. But I didn't want to scare anyone because it was a very sensitive kind of time. People didn't know, and I'm so far from my family. So for the most part, I kind of wanted to just like be low-key about it. But later I shared with a lot of family. They were like, are you okay? I was like, yeah. It's over now.
Did you do any fun things while you were indoors for 14 days? How you were entertaining yourself?
Lots of Netflix. I got sick of Netflix and like watching stuff online. But my whole thing was, oh, maybe food will bring me comfort. And the freaking food, that was super like annoying. I did Zoom with a bunch of friends once I started feeling like a bit better.
So I'm curious to know that how was that one, very difficult day was for you?
You know how like when you have flu, for example, right? Like when you get the fever, and viral fever is usually, it kind of drains you. It's like super intense because your body is like fighting something so intense, right? I couldn't even get out of bed. I didn't eat all day because like I just didn't have the motivation or energy. And there was not a whole lot of energy left to think clearly. I take my vitamins and stuff, so I kept taking those. The next day I ate.
Appy, since you didn't see any doctor or anything, you just talked over phone. How did you know what to eat? Did they advise you?
No, but after the first day, I made an effort to like try to stay healthy, like eat well, like work out. I was also working out in my apartment.
Is it?
Only in the beginning.
Alright, so
So
Sushant, sorry, मेरे पास
that's how you prepared yourself for the 14-day quarantine, right? Keep working out, keep
Yeah.
eating healthy
Yeah.
food, keep watching lots of Netflix.
Yeah. I watched so many pandemic-related Netflix movies. It's crazy.
Yeah, right. ये
It's
हो
like,
रहा है हमने
oh, ऐसा होता है? अरे बाप रे.
क्या
Another
किसी एक
lockdown.
कैरेक्टर से बहुत स्ट्रांगली रिलेट किया तुमने अपने आप को कि यार ये मैं हो सकती हूँ?
Like movies तो इतनी exaggerated है. It's like, oh my gosh, चेहरे से blood निकल रहा है. And
कोई तो स्टैंड अप कॉमेडियन यही बोल रहा था कि इस पैंडेमिक ने हॉलीवुड को फेल कर दिया है क्योंकि जितनी पोस्ट एपोकलिप्टिक या एपोकलिप्टिक स्टाइल मूवीज होती है उसमें तो दिखाते हैं कि कुछ हुआ और डिजास्टर ही हो गया, लेकिन यहाँ पे इतना बड़ा पैंडेमिक है, आदमी घर में बैठ के वीडियो गेम खेल रहा है, ये नेटफ्लिक्स देख रहा है. ऐसा तो है नहीं कि सड़कों पर उतर के मारकाट शुरू हो गई हो.
हाँ, ये बहुत सटल है, you know. जैसा रेसिज्म यहाँ पे सटल है, वैसा ही पैंडेमिक भी सटल है. तो obviously.
Appy, while you were sick, what is the weirdest desi nuskha advice you received?
I think I read कि like garlic and ginger, people were saying you should consume like raw garlic and raw ginger.
Oh God.
I didn't eat like raw anything, but in general I like hot drinks and hot tea, especially when you're having like sore throat and stuff. So I
Yeah.
did that.
Yeah, that's the usual stuff people do.
Yeah. No like crazy like Baba Ramdev stuff.
कोरोना ने ट्राई नहीं किया था. अच्छा, कोरोना उस वक्त आया नहीं था.
आया नहीं था.
So Appy, this virus, इसका effect professionally कैसा रहा? Like your work, your doctoral research, how is that going?
Like I said earlier, a couple of days after I started my quarantine, our lab shut down. Our mentor having meetings with us on Zoom, and she was telling us prepare for the long run. And she had us all come up with like a plan of keeping ourselves productive during that time. Thankfully, there was a lot of writing to be done. Write like grants, write papers, write my thesis proposal. To be honest, for me, it was really hard to be super productive because the world was on fire. That's how it felt. It's like, I don't even know if the world is going to be here a week from now. What's the point of this PhD? लोग बचेंगे कैंसर से बचने के लिए.
Appy, you mentioned earlier that you got tested. Can you tell us more about it? What kind of test and क्या procedure था, क्या process था? You went somewhere या घर पे लोग आए थे sample लेने?
Before returning to work, we were told to get the COVID-19 test and also the antibody test. and it's a serology test, basically. There's a list of places you can go to, and it's like a free test for people who live in New York. And they take your blood, they take the serum out of the blood, which is why it's called the serology test, and they look for either the antibody or the active virus itself in your blood, basically. Also, the nasal test, where they put this swab in your nose, that's the virus cut test. It's really uncomfortable, by the way, so I don't want to do it again.
So that antibody test is now readily available in New York?
Yes.
Do we have that test available in India?
In a recent article, it was mentioned that we'll be starting doing these tests again. In fact, they've targeted a lot of homes.
Oh, wow.
My testing was also through the nasal swab. हमारा वो drive-through center है, so you check in online, just drive there and you don't have to step out of the car. तो बस अपना का window lower करो, वो आपका नाक में swab डाल के 2 बार ऐसे घुमाएंगे. बहुत ही बेकार एक्सपीरियंस है वो. पहली बार ऐसा कुछ था कि मेरी नाक में इतनी डीप कुछ गया हो.
ऐसा तो कुछ फीलिंग नहीं आई कि साला कट्टा वट्टा निकाल ले कि लाओ बताते हैं तुम्हें साले कैसा लगता है.
What was the reaction of your colleagues upon your return to work?
Because वापस जाने से पहले we had to get tested. So the reaction was like neutral, because we only went back in like small batches, and we have staggered like schedules as well. So not everyone can go back at the same time. And also it's voluntary at this time. If you feel scared for taking the subway and commuting and stuff, you can stay at home and just do work from home.
So Appy, you have started, going back to work. You are there in New York, which is actually the epicenter right now. So what do you think about the reopening strategies which are being proposed now?
To be honest, I'm pretty satisfied with the reopening strategies, at least for New York State right now, because it's being much slower compared to other states. So many of my friends have told me they can continue working from home through December. My nature of work is such that I cannot spend more than a certain amount of time at home. I need to do physical experiments and things like that. वो घर से नहीं हो सकता. But many friends in finance, in IT, data science, even fashion, they all have been told you can work all the way to December. So I think personally, if you know already that your immune system is vulnerable somehow, like your health is compromised somehow, your immune system is compromised, your age is in a certain category, you're like obese, and all of the factors that we already know about, if you know for sure that this is something that can affect you, you should be careful. No matter, even if you're in phase 4 right now, you should probably stay indoors more than you should stay outdoors, and you should try not to go back to.
So given your scientific background, do you believe that COVID-19 is here for the long run? And what is your opinion about the research that's going on in the field?
It is here for the long run, but so many people are working to research solutions to this problem right now, all over the globe. So I have a lot of hope. For example, dexamethasone is one of these cheap steroids that was recently found to be effective in curing COVID-19 patients. So that gives me a lot of hope, because there is a lot of vaccination trials going on, but vaccination trials take a long time because they have to be tested on humans. Phase 1, phase 2 करने में बहुत, मतलब अगर safely करना है तो बहुत time लगेगा. उतने time तक you cannot keep the whole world in house. I think there are solutions being worked on. Some solutions are more short term than others. So keeping all of those factors in mind, I do think it's here for the long run. It could even be an annual thing from what I've read. So you may have to get a vaccination every year, just like the flu vaccine.
Are you feeling the pressure to also work on COVID-19? It may be personal pressure or the pressure of the scientific temperament right now. It seems like there's more funding and more flexibility on COVID-19 research than anything else.
No, that's very true. So our lab, we started a bunch of new projects on COVID-19 work. I personally am not on those projects, but I am I guess an advisor on one of the projects, because we produce recombinant proteins, genetically modified proteins, and essentially we used one of our proteins as a template to modify it and create a test for COVID-19 virus as well as antibodies. My PI, she wants to create this strip that looks like a pregnancy test, and essentially you can put any bodily fluid like a spit or something or pee on it, and then it would turn color if you have the positive either virus or antibody on the strip. So it'd be a cheap and easy test that anybody could take at home. You wouldn't have to go anywhere.
So it's under development in your lab?
Yes.
So it's going to come out soon? Do you have a time frame?
This kind of work, it'll take at least 6 months to a year. It cannot be super fast.
Right.
Because there's a lot of cloning and stuff involved. That stuff takes time. Yeah. But I know it's a priority.
Appy, what will you suggest जो लोग जो हैं carelessly they are roaming around और mask उतना नहीं पहन रहे हैं, precautions नहीं ले रहे हैं?
So I think my answer to this question is like kind of playing a devil's advocate. I think we need a balance of being able to go out because like for mental health and also physical health, it is important to leave the house, get some workout in, see people, like getting fresh air, nature, ये सब चीजें भी, vitamin D, like all of these things are important for your well-being. And as well as I would say, like my instinct tells me it also will help you fight any kind of disease. But if you're like being careless, you're not wearing a mask, you're not social distancing, you're not paying attention to who it is that you live with. Like if you live with someone who's older, like who's vulnerable, and you're still being super careless, I think that's socially irresponsible.
Yeah, I think essential situations में you should go out. But हाँ, जैसे दिल्ली के लोग कहते हैं ना, गेड़ियाँ मारना निकल जाएं, वो जो हो रहा है, that is not good.
हाँ, ज़्यादा करना difficult है, लेकिन हाँ, measured amounts में, balanced के हिसाब से. ये नहीं कि crowd कर दिया एकदम बाहर, तो फिर social distancing भी impossible, especially India में तो एकदम ही impossible हो जाएगा. New York में भी difficult है, लोग इतने ज़्यादा हैं.
So Appy, I recently came across this video which talked about anti-mask movement.
Yeah, a lot of people think wearing a mask is like basically you're taking away our freedom, you're forcing us to wear something that we shouldn't be wearing.
It's like connecting everything to human rights. You will not be a human if you are, die somehow.
Yeah. I definitely think it's like over the top.
I have one question. You said that you watched a lot of pandemic-related movies. So when you suffered from corona, so was it really the right time to watch those movies?
I never said I made a good decision. My brain was like, I had the corona brain, guys. I went to a dark place. I was like, kya hota hai pandemic mein? What's the worst thing that can happen? I think Netflix is nefarious in this sense. People are already feeling like anxious and depressed. And Netflix is like, acha, ye zombie movie dekhni hai. Isme sab mar jate hain. And I was like a zombie. Okay, Netflix, whatever you say, click, number one, click. And it was not good. I was having nightmares. Like my brain went to a really dark place because of those images,
Appy, with your experience in New York, so you have seen all the medical facility that New York or United States can provide. Do you think a country like India is equipped to tackle a pandemic of this scale?
The population of India is just so massive compared to US, and relatively jo healthcare system hai, it's not nearly as extensive. So I don't think in that sense India is nearly equally equipped. But the way India is equipped is we also have a younger population. And if we can be like sensible about the way we deal with this scenario, like being outdoors and stuff, I think most of us should be okay. This is just my opinion. It's sad to say some people will still get sick. Hopefully we'll just have medication for them to treat them. But other than that, I don't know how it's going to play out.
What's your greatest concern now regarding your traveling from US to India? Because this pandemic, it seems like it will be staying with us for some time now.
Yeah, so that's a relevant question because travel is definitely a really high risk. I think unless extremely highly important, traveling should be limited. But I do know like people who've traveled, like there's been a lot of precaution even on the airplanes where they're wearing like face shields the whole time and they have only one person per row, so they are able to distance.
That's about it for our today's episode. I would like to thank Appy for accepting our invitation and share her story. We know that this is a serious disease and we tried to present a very serious topic in a lighter way from the perspective of the person who actually survived. If somewhere we have crossed our lines, please forgive us. But I think this video would give you more information to the people who might end up in a situation like this and would be better able to prepare for it. I hope you like this episode. Please like, share, and subscribe. And we also have all our content in podcast platforms, and you can find the links in the description below. And we'll see you in the next episode. Thanks for watching. Bye-bye.
Bye.
Bye.
Stay home. Stay safe.
Okay, guys, so stay home, stay safe.
हाँ, सुशांत तुम थोड़ा आगे होके बैठो, अभी तुम बहुत फट गए हो।
हाथ नीचे रखो।
सब
जहाँ पे
मम्मी
हो।
हो गए हैं सब, हाथ नीचे करो, सीधे बैठो। अंकल क्या
screen.
सोचेंगे?
All the
देखो
time. Okay.
श्रीवास्तव जी का लड़का कैसे बैठा है।